Immunoglobulins, antibodies. 5 major classes: IgA, IgD, IgE, IgG, and IgM. These are synthesized in plasma cells as an immune response. IgG can cross the placenta. It is increased in liver disorders, infections, and collagen disease. On the other hand, it is decreased in the presence of increased susceptibility to infection and when a monoclonal gammopathy is associated with an increase in another immunoglobulin. IgA levels increase after birth. They are increased in liver disorders, infections, and autoimmune diseases. Conversely, they are decreased in inhibited protein synthesis and hereditary immune disorders. IgM cannot cross the placenta. It is made by the fetus. It's often increased in various bacterial, viral, and fungal infections, and in conditions like Waldenstrom macroglobulinemia. On the other hand, it can be decreased in renal diseases associated with protein loss and immunodeficiency disorders. IgD is increased in liver disorders, infections, and connective tissue disorders. IgE is increased in allergies, asthma, and hay fever, and during parasitic infections. Fibronectin. Fetal fibronectin is used to predict the risk of premature birth. It is a normal constituent in the placenta and amniotic fluid. When stress, infection, or hemorrhage causes leakage of fibronectin into the cervicovaginal secretions, increased fibronectin is suggestive of risk for premature birth. Methodology for serum, total protein, albumin, and protein fractionation. Refractometry is based on the change in velocity of light as light is bent, as it passes through the boundary between air and water, which function as two transparent layers. In protein analysis, the light is bent, and such change is proportional to the concentration of the solutes or proteins present in the water or serum. The BRA method is based on cupric ions complexing with peptide bonds in an alkaline medium to produce a purple-colored complex. The amount of purple complex produced is directly proportional to the number of peptide bonds present and reflects protein concentration. Dye-binding techniques allow proteins to bind to a dye, forming a protein-dye complex that results in a shift of the maximum absorbance of the dye. For example, Kumasi brilliant blue. The increase in absorbance is directly proportional to protein concentration. The Kjeldahl technique for the determination of total protein is too cumbersome for use in routine testing. It is considered the reference method of choice to validate materials used with the BRA method. The Kjeldahl technique is based on the quantification of the nitrogen content of protein. Serum protein electrophoresis. Serum is applied in the cathode region of an agarose gel or cellulose acetate plate saturated with a buffer of pH 8.6. Serum proteins have a net negative charge and migrate toward the anode, with albumin traveling the farthest, followed by C globulins, A2 globulins, B globulins, and Y globulins. The proteins are fixed in the medium, stained, and then quantified using a densitometer. Immunochemical methods include homogeneous and heterogeneous immunoassays, immunonephelometry, immunoelectrophoresis, radial immunodiffusion, electroimmunodiffusion, and immunofixation. Test methodology for albumin. Dye-binding techniques using bromcresol green and bromcresol purple dyes allow albumin to be positively charged for binding to the anionic dye, forming an albumin dye complex that results in a shift of the maximum absorbance of the dye. The increase in absorbance is directly proportional to the albumin concentration. Test methodology for globulins. The direct measurement of total globulins is not generally performed. The concentration of the globulins is determined by calculation. Globulins equals total protein minus albumin. Proteins and other body fluids. Urinary proteins. Quantification performed on 24-hour urine specimens. Test methods include sulfosalicylic acid, trichloroacetic acid, benzethonium chloride, turbidimetric, and Kumasi brilliant blue, spectrophotometric. Reference range for urine total protein is 1 to 14 milligrams per deciliter, less than 100 milligrams per day. The clinical significance of proteinuria is important. Increased protein in urine may result from tubular or glomerular dysfunction, multiple myeloma, Waldenstrom macroglobulinemia, and nephrotic syndrome. Bence-Jones protein may be found in urine of patients with multiple myeloma. The glomerular membrane can be damaged in conditions like diabetes, amyloidosis, and collagen diseases. Glomerular dysfunction can be detected in its early stages by measuring microalbumin in urine. Microalbuminuria is a condition where the quantity of albumin in the urine is greater than normal, yet it is not able to be detected by the urine dipstick method. The presence of microalbuminuria in a diabetic individual is a concern because it generally precedes nephropathy. Cerebrospinal fluid, CSF proteins. CSF is an ultrafiltrate of plasma formed in the ventricles of the brain. Test methods include sulfosalicylic acid, trichloroacetic acid, benzethonium chloride, and coomacey brilliant blue. The reference range is 15 to 45 milligrams per deciliter. The clinical significance is noteworthy. Increased CSF proteins can be seen in viral, bacterial, and fungal meningitis, traumatic TAP, bloody, multiple sclerosis, herniated disc, and cerebral infarction. Decreased levels can occur in hyperthyroidism and with central nervous system leakage of CSF.